They told me she died while I was inside the OR, cutting open another man's chest, trying to restart his heart, while mine was already breaking. What kind of father saves someone else's child and loses his own? What kind of God watches that happen and does nothing? I remember the monitors, the cold light, the smell of disinfectant. I remember the scream in the hallway. I just didn't know it was mine. Yet, was it destiny, punishment, or just a moment too late? Would she still be alive if I hadn't picked up that scalpel? Or did I kill her by choosing to be a doctor? I was wearing gloves soaked in someone else's blood when they handed me her name on a chart. Room 302, Pediatric Trauma. My daughter. I dropped the clamp, didn't even notice. My hands were shaking, not because of the surgery, but because I knew there's no way to run fast enough once you've already chosen the wrong direction. I saved the patient. He walked again, he even thanked me, but my little girl never opened her eyes again. So, what do you do with a miracle when it costs you everything? Would you still save a stranger if it meant burying your child? They say doctors make impossible choices, but no one tells you what it's like to live with the right one or the wrong one. I wasn't supposed to be there that night. It was my day off. I had promised my wife I'd be home early, and for once, actually stay. I even packed her favorite dessert. Lena loves strawberries. Not the fruit, just the flavor. She says real strawberries make her sad. Too soft, too fragile. She was right. Anyway, I was halfway to the parking lot when my pager buzzed. Cardiac arrest, incoming, OR3. The nurse looked at me, wide-eyed. Doctor, Morgan, he's just 16. 16. So I turned back. Back to the chaos. Back to the light that never dims. Back to where I thought I belonged. I didn't know then that Lena was bleeding out in an ambulance half a mile away from where I was cracking open another chest. They say trauma always finds you when your guard is down. But I let it in. The boy had a torn aorta, motorbike crash, no helmet. We cut fast. The room was hot, sticky with sweat and suction tubes. My hands moved before I could think. Clamp, cut, stitch, push, shock, again. And then, rhythm. A weak but steady beat. The kind that gives you hope. The kind that makes you feel like God, for a second. And that second was exactly when Nurse Haley entered the room. She didn't speak, didn't have to. She just held out a piece of paper, white, crumpled, trembling in her hand. Room 302, Pediatric Trauma. ETA 2 minutes. I blinked at her. So? She didn't answer, just stared. Her lips moved, but no sound came out. So I read the name on the paper. Lena Morgan, age 8. No, number I ran. I don't remember how my legs moved. I think I knocked over a tray. I think someone yelled my name, but all I could hear was her voice, echoing in my head. You never miss bedtime, Daddy, promise. I promised. I reached the ER bay just as they wheeled her in, covered in glass, her arm twisted in an angle no body should make, her face pale, but worse than all of it, her eyes were closed. I froze. Not because I didn't know what to do, but because I didn't know if I should. Was I her father or her surgeon? Do I grab the defibrillator or her hand? Do I call for a crash cart or my wife? Where the hell was my wife? Another doctor stepped forward, young, confident. He reached for the chart in my hand and said, I'll take this one, doctor. Morgan? I nodded, but didn't move. I couldn't. I just stood there, watching them surround her, as if she were just another case. She wasn't. She was 8. She liked purple Band-Aids. She hated loud noises. She used to hide under the piano during thunderstorms, and now she was on a gurney, lost beneath a sea of latex gloves and antiseptic. She was waiting in room 302. For me, but I wasn't there. I chose the boy in OR 3. I saved him. And maybe that's exactly when I lost her. They say the white coat gives you power, respect, control. They don't tell you how heavy it gets when your hands start shaking under it. That night, I didn't take it off. I couldn't. I sat in the hallway, still wearing it. Blood stained at the cuffs, my daughter's name still burned into my palm like a curse I couldn't scrub off. I remember staring at the vending machine, thinking how surreal it was that you could buy a candy bar while your child lay between life and death just a few feet away. I was supposed to fix people. That's what I trained for. 4 years undergrad, 4 in med school, 5 in residency, another 2 in cardiothoracic. But no one prepares you for the moment your own child becomes the patient. No textbook, no lecture, no clinical round ever tells you what to do when the line between doctor and father vanishes in one pulse. The attending in pediatrics, Dr. Shearer, he looked me in the eye and said, "You need to let us handle this." I nodded. But inside, I wanted to scream. Let you handle it? That's my daughter on that table. That's my baby with a collapsed lung and a pulse dropping faster than my sanity. I didn't want protocol. I didn't want objectivity. I wanted to kick down the walls and hold her myself, wrap her in my arms and whisper that she'd be okay, even if it was a lie. But all I could do was pace, back and forth, like a man watching a storm roll in through a window he couldn't close. The nurse brought me her necklace, a tiny silver heart. It had snapped in the crash. She wore it every day, even in the bath, said it was for luck. I held it in my fist so tight, the chain dug into my skin. It felt like penance, like a confession with no priest to hear it. Isn't it funny? We comfort strangers every day. We say things like, "She's in the best hands. We're doing everything we can." But when it's your child in that room, those words feel like sand in your mouth. Time moved weird after that, too fast and too slow at once. 1 minute they were intubating her. The next, alarm started screaming. Code blue, her oxygen levels tanked. I heard it all from the hallway. I tried not to go in, I really tried, but something broke in me. I pushed the doors open and stood there. Everyone froze. Dr. Shearer stared at me. Not as a colleague, but as a father who'd crossed a line. He stepped back, let me approach her. And there she was, so small, so still. I touched her hand. It was cold, not lifeless, not yet, but the kind of cold that whispers things you don't want to hear. I whispered her name. "Lena, it's Daddy. I'm here now. You can rest." And then her heart stopped, just like that. The silence hit louder than any alarm ever could. They pulled me back, started compressions, epinephrine, more compressions. You'd think a man who's brought back 30 hearts would believe in second chances. But in that moment, I didn't. I couldn't. Because this time, the hands on her chest weren't mine. The rhythm they chased was slipping away, and the coat I was wearing suddenly felt like armor I didn't deserve, like a mask, a lie, a badge of failure stitched in white thread. And I knew, even if she survived, something in me had already died. They say grief is a silent killer. It doesn't announce itself with alarms or pagers. It sneaks in, like a shadow crawling over the brightest day. For me, it wore a white coat. I walked out of that hospital room, carrying nothing but her broken necklace and a heart shattered into pieces too small to fix. I went home that night, or what I thought was home. The house was empty, too quiet, the walls held their breath, and the air was thick with things unsaid. I found her favorite teddy bear, sitting on the couch wearing a tiny crooked smile. The same smile she gave me before her last nightmare. I sat there, holding the bear, and for the first time, I let the weight of everything fall. I cried like I never thought I could, because doctors don't cry. Not in front of others, not in the hospital, but alone? Oh, alone. We let the pain in, and it consumes us. I tried to go back to work. I had patients waiting, lives depending on me. But every time I walked into the OR, I saw her face, looking at me with empty eyes. I couldn't scrub it out. No antiseptic was strong enough. I started to doubt everything, my skills, my purpose, my faith. How do you save a stranger when you've lost your own child? How do you hold hope in one hand while the other is empty? One night, I found myself in the hospital chapel. I don't believe in much, but that night I whispered a prayer. Please, tell me why. No answer came, only the sound of my own breathing. The staff tried to help. Colleagues asked if I needed time off. Counselors offered sessions. But the truth, no one can fix a broken father, not with therapy, not with words. I started to isolate myself. Avoided calls, skipped meetings, faked smiles. I was a ghost walking hospital halls, wearing the weight of my failure like a shroud. The white coat became a prison, each stitch a reminder of promises I couldn't keep. I caught myself staring at her empty room. The walls still held her drawings, a rainbow made of shattered hopes. I sat on the floor one evening, touching the cracked paint, feeling the silence scream. I wanted to scream, to break something, anything, to feel alive again. But all I felt was numb. My wife, Sarah, tried to hold me, but I pushed her away, not because I didn't love her, because I was afraid. Afraid that if I let her in, I'd fall apart completely. So I built walls. High, cold walls. Around my heart. Around my grief. And inside, the pain roared louder than any heartbeat. There's a moment, a sharp crack inside you, when everything you thought you could handle snaps. That night, I found mine. I was back at the hospital, walking those endless, sterile corridors. The fluorescent lights buzzed overhead, casting cold shadows on the walls. I passed by the ICU. A nurse caught my eye. She was holding a baby, healthy, crying, normal. And I wanted to scream, not at her, at me. How could I let Lena slip away? How could I save others when I failed the most important person in my life? The weight of the white coat felt unbearable. I was suffocating, drowning in guilt, grief, and anger. I remember sitting in the locker room, tearing off my coat, throwing it on the floor. It landed like a lifeless body. I screamed, loud, raw, but no one heard. Later, I found myself outside, rain falling, cold, relentless. I stood there, drenched, wondering if the storm outside was any different from the one inside me. It wasn't. Days passed, or maybe weeks. Time lost meaning. At work, my hands betrayed me. I fumbled instruments, missed doses, forgot protocols. Colleagues noticed, whispers behind closed doors. He's breaking. Burnout. Needs to step back. I wanted to argue, to say, you don't know what I'm carrying. But I was too tired, too broken. One evening, the hospital called. My wife was on the line, her voice trembling. He's not responding. He's gone into arrest. I dropped the phone, ran to the ambulance bay. There, I found my best friend, Mark, his face pale, eyes wet. He collapsed after his shift. We tried CPR. I couldn't breathe. Not because of the rain or the cold, because inside me, I was already dead. In the ICU, they hooked me up. Monitors beeped. I lay there, staring at the ceiling, thinking about Lena. Was this my punishment, my escape? But something inside me refused to give up, some tiny spark, a fragment of hope. I remembered her smile, her purple band-aids, the way she said, "Daddy, you're my hero." I realized then, this breaking point was also a beginning. Cliffhanger, Chapter 5, Redemption's Edge. I had to decide, keep falling or find a way back, but the hardest choice was yet to come. They say redemption is a road paved with broken pieces. You can't rebuild what's shattered without stepping on the jagged edges. I stood at that edge, looking down at the abyss of everything I had lost. My daughter, my family, my faith in myself. For months, no years, I lived as a shadow of the man I used to be, haunted by memories, haunted by silence, haunted by the question that never left me. Did I fail her? I remember the first time I walked back into the OR after Lena died. The room felt colder than ever. Empty, hostile. Every beep of the monitor was a reminder of the rhythm I couldn't save. I scrubbed in for a routine valve replacement, but my hands trembled so badly the nurse had to steady me. I wanted to scream, "I'm broken!" but instead I whispered a prayer. Please, don't let me lose another heartbeat. Slowly, very slowly, I started to find small reasons to stay. A patient's smile, a thankful nod, a child's laugh echoing down the hallway. And then there was her. A little girl, no older than Lena, diagnosed with the same injury, the same fragile heart. Her name was Emily. I took her case personally, every stitch, every breath. I whispered to her under the surgical lights, "You're stronger than you think." Emily survived. She walked out of the hospital with her mother's hand in hers, just like I had dreamed Lena would. And in that moment, I realized something. I wasn't saving just my patients, I was saving myself. Because grief doesn't have to be a prison, it can be a forge, where broken souls are reforged into something stronger. But redemption isn't free, it demands sacrifice, facing your darkest fears, admitting your worst failures. I called my wife that night. We talked for hours. We cried. We promised to rebuild, not just our family, but me. I started therapy. I opened up, let others in, no longer afraid to show the cracks in my armor. I learned that healing isn't linear. Some days are good, others are impossible. But I keep moving forward, because Lena taught me that life is fragile and precious. 1 year later, I walked past room 302. The door was closed, silent. But I left something there, a small silver heart necklace, just like the one Lena wore. And I whispered, "Thank you for teaching me how to fight." I still carry the weight of the white coat, but now, it's not a burden, it's a reminder that every heartbeat matters, and every second counts. Because in the end, saving others is the only way I can honor what I lost. The camera slowly pans to a hospital corridor bathed in soft morning light. I stand alone, looking at my reflection in a polished glass window. My face tired, worn, but calm. I lost my daughter, but I found my purpose.